Teenage pregnancy, from stigma to support. From a historical standpoint, teenage childbearing has been on a long-term decline in the United States since the late 1950s, except for a brief but steep upward climb in the late 1980s through 1991. Teenage births declined in the 1990s, possibly due to increased sex education in the schools and the federal prevention programs aimed at adolescent pregnancy. 2000s to present, teen pregnancy rates dropped significantly, possibly due to better access to contraception and education. However, disparities still persist. Ventura et al., 2001. Implications for the beloved community. Intergenerational poverty, educational inequity, and limited access to healthcare. Teen mothers face a variety of detriments across the life course, including truncated educational attainment, Kane et al., 2013. This means that the years of schooling or educational consequences for teen moms can be anywhere from 0.7 to 1.9 years less than non-mothers. Socioeconomic factors that influence pregnant and parenting teens include, but not limited to, underemployment, low income, and lower educational levels. Penman Aguilar et al., 2013. Teenage mothers and fathers tend to have less education and are more likely to have lower incomes than their peers who are not parents. Moreover, lower levels of education reduce a teen parent's potential for economic self-sufficiency. Mickler and Tolstrup, 2025. Persistent disparities in teen birth and repeat birth rates exist, particularly in areas with limited or threatened access to reproductive health care. Nandy et al., 2018. Physical and emotional effects on teen moms. Teen pregnancy can cause a list of health issues, including higher risk of complications, preeclampsia, anemia, gestational hypertension, changes in body image, weight, and nutrition, postpartum depression, breastfeeding issues, and sleep deprivation. Gates, 2024. Shame and stigma. This ad campaign in New York City shows stereotypical responses to teen pregnancy, addressing both mom and dad. The scare tactics are very shame-based and hint at poverty being an issue. The campaign mentions cost, educational consequences, and relationships. Shame and Stigma, Humberstone, 2019. Teen pregnancy often affects young people's social relationships and school experiences in profound ways. Many teens experience stigma and judgment from both peers and teachers, which can lead to changing their school placement, attending alternative or homeschools, which can limit their educational and social opportunities. This can begin even before birth and possibly with abortions if coming from more advantaged homes. Teen parents may also experience decreased peer acceptance or even lose friends who cannot relate to their newfound experiences. Fathers can experience stigma too. From the University of Lincoln, it stated that fathers have previously been seen as uninterested, risky, or even irresponsible. Shows like MTV's Teen Mom have not helped the stigma due to its glamorizing of teen pregnancy and not talking about the actual realities of becoming a parent at a young age. Contradiction to community compassion. Stigma often counteracts any support and empathy a young parent needs. Stereotypes ultimately hurt teens from seeking help. Judgments can cause isolation both physically and emotionally. Shame causes teens to feel like they can't be good parents simply because they are young. From Viana, 2014. As Natasha Viana states in her article, Shame and Stigma, How It Makes Young Parents Feel, she says, stigma can pressure us to avoid making ambitious goals or striving to overcome challenges. Stigma keeps us in a place where others can still narrate and dictate our lives. Alignment with restorative justice. This may look like community and social supports, accountability, and healing. Smiley et al., 2023, in their paper, Social Support, Resource Utilization, and Well-Being, a survey of adolescent parents in Washington, D.C., states that among teen parents, greater self-reported social support was positively correlated with higher self-rated physical health, mental health, and well-being. This could come from family connections, parenting support programs, or even school-based programs for parenting teens. Alignment with social inclusion. This may mean looking at addressing systemic barriers and providing comprehensive support. The Office of Population Affairs, through the U.S. Department of Health and Human Services, suggests the following strategies. Provision of wraparound services, which may include parenting resources, access to workforce training, healthcare, and education. Case management, with referrals to healthcare centers, children's developmental progress, and parenting classes, as well as community and state-level collaboration, which may mean working with nonprofits, academic institutions, and other key stakeholders. Teen pregnancy and its impact on human rights. Teen parents have the right to education, healthcare, and family support. In my personal experience working and teaching teen parents, both moms and dads, some of the issues that they have relayed have been issues with education that included unexcused absences for pregnancy and child-related doctor's appointments, as well as teachers refusing to allow them to do makeup work. Issues experienced with healthcare included reproductive health services and access to things like pregnancy Medicaid. Family support can include everything from housing and financial support to simply being present when the teen parent needs a break, like any other parent, or even transportation to and from appointments. Connection to the Belmont Report principles. While the Belmont Report from the Office of the Secretary et al., 1979, does not specifically mention teenage pregnancy, the principles within still apply. Respect for persons. Though teen parents are still minors, parental permission should still be obtained. However, teens still need the ability to give informed consent. Beneficence. Pregnancy in general has its risks, but young mothers may have other potential harms, including emotional stress from questions about their personal history. Justice. Any service or prevention practice should be accessible to all youth, not just the more privileged. Research that involves adolescents is essential to improve adolescent health care, yet adolescents are often underrepresented in research and trials, states the American College of Obstetricians and Gynecologists and Committee on Adolescent Healthcare, 2026. Teen pregnancy inequity. Considering how social determinants of health affect everyone, when it comes to teen parents, they can be strongly linked. Fuller et al., 2018. Economic stability. Poverty and lower incomes can impact the access to much-needed resources. Education. As previously stated, teen parents often have fewer years of schooling than their non-parent peers. Social and community context. Daughters of teen moms have a higher likelihood of becoming a teen mom themselves. Liu et al., 2018. Teen pregnancy inequity. In Union County, there remains an unfortunate imbalance in the distribution of resources between different areas of the county. This issue was brought to light during the 2018 Health Equity Institute hosted by Union County Human Services entitled A Tale of Two Union Counties. Some structural barriers that are connected to this are the underfunded schools, limited healthcare access, and lack of public transportation. These issues are mainly seen in the eastern side of the county, Wingate, Marshville, and New Salem, for example. Teen pregnancy and justice. Community-based programs are needed to promote access to education, childcare, and empowerment. With education, Smart Start Best Start utilizes counselors to teach life skills needed to parent infants and young children, model and reinforce positive parent-child interaction, and facilitate regular school attendance and encourage high school graduation. Child care subsidy helps low-income families pay for much-needed childcare. Empowerment. Programs such as parenting support, Circle of Parents, and breastfeeding support provide valuable encouragement to young parents navigating behavioral challenges, caring for children with exceptionalities, and to mothers seeking assistance with breastfeeding success. This comes from theallianceforchildren.org. Possible policy change to address pregnant and parenting teens. Expanding access to adolescent-friendly reproductive health services. Union County Human Services, the Department of Public Health, already has a family planning clinic that is accessible to any sexually active patient who desires birth control, regardless of residency or age requirements. However, there could be an offshoot program connected to the clinic that only focuses on adolescents ages 10 to 24. Services provided could include annual exams and education, screening for sexually transmitted infections, access to various contraceptive methods, maternity and postpartum services, as well as referrals to related programs like parenting support, WIC, breastfeeding support, and child care subsidy, among others. From the Union County, North Carolina government website. Expanding access to adolescent-friendly reproductive health services. Local collaborations for this program could include Union County Public Schools, in particular, school nurses, Best Start counselors, and guidance counselors. Union County Transportation, with little to no fee for appointments. Alliance for Children, with a memorandum of understanding for programs who share clients. And Atrium Health. Funding considerations would include Union County government, Alliance for Children, the local Smart Start agency, Atrium Health, and federal grants, in particular, the Title V Maternal and Child Health Block Grants, the National Institutes of Health Office of Research on Women's Health, and Rural Maternity and Obstetrics Management Strategies Program. In closing, teen pregnancy is not only a personal trial, but a social issue that affects the entire community. Its impact extends beyond the individual, defining families, schools, and local economies. Communities with higher rates of teen pregnancy can often experience cycles of poverty, limited educational attainment, and reduced health outcomes. Addressing these challenges requires compassion, understanding, and proactive investment in the futures of young people. References: the Alliance for Children, American College of Obstetricians and Gynecologists, and Committee on Adolescent Healthcare, Community Support for Young Parents, Family Planning Clinic, Fuller et al. Funding Strategies for Maternal Health Programs, Gates R. 2024, Humberstone 2019, Kane et al. 2013, Liu 2018, Mickler and Tolstrup 2025. Nandy et al. New York and Chicago Ad Campaign, Office of the Secretary, Penman Aguilar et al., Smiley et al., University of Lincoln, Viana and Ventura et al.